This videos contains scenes that might be disturbing for some viewers. In Sierra Leone, a country in West Africa, there's a serious problem with a drug called the zombie drug. This drug, also known as kush, is made using ground-up human bones. It first showed up in Sierra Leone in 2018. People who take this drug can feel a strange and hypnotic high that lasts for hours. However, it has become a huge issue for the government. The situation has gotten so bad that some drug dealers are robbing graves to get the bones they need to make the drug. This has led the government to declare a state of emergency. They're now guarding cemeteries to stop people from digging up skeletons to make the zombie drug.
They say I have to purge my body of this substance. Since I started smoking 5 years ago, my body is now addicted to this thing. I have to buy medication, but I don't have the ability to wean myself off it, so it's difficult for me.
Sierra Leone's president, Julius Maada Bio, has acknowledged that the country is facing a serious problem. He's set up a task force to fight against the spread of this dangerous drug. The government is also working on building support centers in every part of the country. These centers will have trained staff who can help people dealing with drug addiction. The goal is to stop the chain of drug abuse by investigating, arresting, and prosecuting those involved.
Young people are dying. Young people are dying. We need a speedy and refocused strategy to see how young people are taken from this drug intake. But at the moment, it is quite alarming.
However, there's only one drug rehabilitation center in Sierra Leone, located in the capital city, Freetown. Unfortunately, this center isn't enough to handle the growing number of people needing help. Despite the lack of official numbers, it's clear that the impact of the zombie drug is severe.
What we see in the hospital can be likened to the tip of an iceberg, where only the severe cases are being brought. But if you go down to the communities, if you go down to the parks, you go down to the streets, you go down to the ghettos, you'll find much more, people using these substances and the impact has been created on them than what we see here.
Between 2020 and 2023, the number of people admitted to the Sierra Leone Psychiatric Hospital with illnesses linked to the drug rose by a shocking 4,000%. Sierra Leone is facing a tough battle against this dangerous drug. With the government's efforts and support from the community, there's hope that they can overcome this crisis and help those affected by addiction.
I would like to tell colleagues out there that these substances that we do take, that they do take, because I'm no longer part of them now, because I'm now a changed person. These substances that they do take, that we call kush, is not something good for their health.